Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is particularly geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. During today's webinar, we will be talking about recent updates to nursing home visitation and testing guidelines. Everyone will be on mute today, but if you have any questions, we encourage you to enter them into the chat at any time, and we will address them throughout the webinar. And we also encourage you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, we will be discussing myths about COVID-19 vaccination. My name is Kathy Caudill, and I'm a communications specialist with Quality Insights. And without further ado, I will get us started, and we will follow up with all of your questions at the end of the presentation. On today's episode, we are talking with Penny Imes from our Quality Insights team. She is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. And she found her perfect combination for all of that here at Quality Insights, where she is able to work in quality improvement with long-term care nursing homes. So welcome, Penny, and thank you for joining us today to talk about the latest visitation and testing guidelines for nursing homes amid the COVID-19 pandemic.
Thank you, Kathy. I'm happy to be here.
All right, Penny. So we know that earlier this month, the Centers for Medicare and Medicaid Services updated its guidance on visitation and testing for COVID-19 in nursing homes. So first, let's talk about visitation guidance. Prior to the update, what was the guidance on visitation?
The original guidance, and this is the CMS memo, QSO 2039 nursing home. As we all know, when the COVID outbreak was at its peak in nursing homes, indoor visitation was suspended as a way to protect residents. And then we all learned during this period of time that residents were experiencing isolation, anxiety, and depression from not being able to visit with family and friends. So as soon as vaccines were developed and approved for use, the nursing home guidance was updated to allow the visitation to start occurring again. And with the guidance, it was still the responsibility of nursing homes to maintain infection prevention practices. So the initial guidance stated that if a visitor, resident, or their representative is aware of the risk associated with visitation, and the visit occurs in a manner that doesn't place other residents at risk, for instance, inside the resident's room, then the resident must be allowed to receive visitors as he or she chooses. And there were still some core principles of infection prevention that nursing homes had to maintain that applied to visitors. And those were things like making sure that signage regarding infection and infection prevention practices were placed around the facility where they could easily be seen. Visitors should be educated on infection control practices such as hand washing or the use of hand sanitizers, use of masks, the correct use of masks, and then physical distancing. And along with understanding when not to visit if they were positive for COVID or still within the time frame for potentially spreading the virus. And this is where the screening process by the nursing home came in to check on all of these things and make sure that the visitors were educated. The original guidance also focused on opening up the indoor visitation while you still practice physical distancing. And then there was limitations to large numbers of people, along with limitations to where the visitation could occur. And that was very much, and still is at this discretion at the nursing home based on your facility layout. And while nursing home staff can't ask visitors for proof of vaccination, the guidance was for them to offer vaccinations and testing to family members. And this is also where some of the changes we're going to talk about today really started, with a focus on that community level of transmission, because a substantial to high level of transmission within a county required all residents and visitors, regardless of their vaccination status, to have to wear masks and physically distance. Although we know, when residents and visitors were alone, especially in the rooms, sometimes personal choice allowed them to take those masks off. So that was really a very brief summary of what the original memo was.
Got it. Okay, so now that we have some background, what is the new guidance on visitation in nursing homes?
Yeah, the updated revisions from earlier this month, on March 10th to be exact, they were really sort of minor, as far as one of them was just really changing the language, the term vaccinated. And then they also updated the visitor screening and quarantine criteria. So while the revision within the memo is minor, there's a lot that comes into play with the screening and quarantine. And all the other things that were originally in the memo, the infection prevention practices, the visitor education, that indoor visitation, and then the education about the vaccines for visitors is still in place. The change in language was to replace that term vaccinated with what we now say is up to date with all recommended COVID-19 vaccine doses. And then they deleted the term unvaccinated. And what that means is up to date means that the person has received all their recommended COVID vaccines, including any booster dose when they're eligible for it. And when you look at the revised memo, you'll see this change in language throughout the revised CMS memo. And then the other part of that, besides the change in language from, from the unvaccinated and vaccinated to up to date with vaccines, is the updated visitor screening and quarantine criteria. So for visitors who have a positive viral test for COVID-19 or symptoms of COVID-19, or currently meet the criteria for quarantine, should not enter the facility until they meet the same criteria that's used for residents to discontinue transmission-based precautions. And that's another reason why the screening process really needs to be in place and look at you, because facilities need to screen all who enter for those visitation exclusions. So you really want to make sure that you're catching the visitors, you're asking the questions, and you're helping them to educate them and to understand how important it is for them not to come in if they are positive, if they've been exposed, if they haven't completed that quarantine period, because then they're putting residents at risk. And the guidance for that criteria, I'd love to be able to say to everybody today that I know what all of those are. I mean, basically in my brain, I know the number 10 sticks out to me, because for most of those things, it's like, I remember a 10-day time period. And that's why we say frequently, and we do this here at the QIO, is make sure that you're jumping onto those CDC websites and CMS and keeping up with the current guidance. And that's one of the things that we try to do for you also. But it's very important to start that practice within the nursing home. But the guidance for what the quarantine criteria is can be found on the CDC website. And I think what nursing homes really need to think about in regards to this, though, is for those people who are following those quarantine guidelines and not visiting, what are some alternatives for in-person visitation that you could do for them during the quarantine period? Those things like providing video chats or phone calls, or assisting residents with reading emails or text messages from family members who can't come in to visit.
And before we pivot to the next part of the guidance, is there anything else you want to add about the visitation policy?
No, but one thing I do want to mention is, as far as boosters, we did find out that the FDA did authorize the second booster dose of Pfizer or Moderna for people 50 years of age or older, at least 4 months after receiving their first booster dose. Now, what we don't know yet is whether this is going to impact what the definition of up to date is, because we haven't heard from either CDC or CMS on this most recent update. So if we don't know if eventually the language is going to change for the long-term care population to include that second booster dose, and if that will impact what up-to-date means.
Probably be hearing about that sometime soon. And you were talking about updates, and I should mention that every Friday we send out an e-bulletin called the Last Minute Newsletter. A lot of our attendees probably are already on the email list for that, but if you haven't been receiving it, let us know. Usually we will drop in those updates. So if you don't want to be bookmarking and checking the CDC and the CMS website every week, we put it in this newsletter every Friday, every time there's a change that you should be notified about. And if you are not getting those emails, you can send us a message here in the chat, and we can get your email added to that list. All right, so let's move on to the next thing. So the other update is regarding COVID-19 testing in nursing homes. So starting with some background, what was the guidance on that up until now?
And the original guidance, and this was CMS memo QSO 2038 nursing home. And what that memo did, that guidance set guidelines for testing that included how frequently you needed to test, the criteria for testing, and then also the documentation and reporting requirements for nursing homes. And the original memo included a table summary that outlined your testing for staff and residents. And it was based on whether they were symptomatic, identified as COVID positive, or if it was for routine testing requirements, which is recommended for staff, not for residents. And then it also included a table for testing that was based on county level of community transmission. And it's the county level of community transmission that's used for healthcare facilities. And that's a bit different from the CDC community level recommendations. So community level recommendations are for everybody that's not in a healthcare setting, and the county level of community transmissions data is for healthcare facilities.
And sorry, I was looking at my notes. And what is the new CMS guidance on COVID-19 testing in nursing homes?
Well, this is again where sort of one change was just language. The language was also changed to reflect what the up-to-date and not up-to-date, rather than using vaccinated or unvaccinated. And then the table 1 changes, really, it was just that language of rather than saying they're vaccinated or unvaccinated, it states regardless of vaccination status. So it didn't really change anything. It was just the language that changed with that. But the other change that was up to the updates was the recommendation for testing individuals within 90 days after recovering from COVID-19. So in general, testing is not necessary for asymptomatic people who have recovered from SARS-CoV-2 infection in the prior 90 days. However, if testing is performed on these people, an antigen test instead of a NAT or nucleic acid amplification test is recommended. Try saying that 3 times fast. So they recommend if a test is done on someone who has recovered from COVID infection in the prior 90 days, they recommend that you use an antigen test instead of the NAT test. And that's because some people can remain NAT positive, but actually not be infectious during this period. And two things that I really want to point out with the testing is that the facility should test all staff who are not up to date at the frequency. And this is in the original guidance, but I think it's also really important to just mention while we're talking about this. So this isn't a change, but I just think it's something important to mention, that the test of staff who are not up to date should be done at the frequency that is prescribed in the routine testing table. And again, it's based on that level of community transmission reported in the past week. And again, this is where I say, know what's happening there. There's the CDC website, there's the CDC data tracker, the COVID data tracker, so that you can pull up what your level of community transmission is. And facilities really should monitor their level of community transmission every other week and adjust the frequency of performing your staff testing according to the table above. And this is right out of the memo. This isn't me suggesting it or recommending it. This is what's in the memo. So if the level of community transmission increases to a higher level of activity, then the facility should test the staff at the frequency shown in the table, has the criteria for the higher activity level is met. And then if the level of community transmission does decrease to a lower level of activity, the facility should continue testing at the higher level until the community transmission has remained at the lower activity level for approximately 2 weeks before you reduce your testing frequency. And that guidance above represents the minimum testing that's expected. And because facilities, nursing homes, you need to consider in other factors. For instance, if the level of community transmission in a neighboring county is to test at a higher frequency that's higher than what's in your county, you have to be aware of that, because sometimes what happens very frequently is you might be in a facility, your facility is in a county with a low level of community transmission, but you might have a lot of your staff who live in the next county where they have a moderate level of community transmission. And that's when the facility should consider testing based on that higher level of community transmission. And then the second thing, again, is just to say that, continue to monitor the CDC webpage, the COVID tracker, frequently asked questions. And again, as Kathy said, that is something that we try to make sure that we're updated with all that guidance. It's on our website. It's in the weekly lowdown that we send you. And we're always available here for questions.
Yeah, which reminds me to let people know we have open office hours if you ever want to have just come and join our live chats. We do them twice a week. On Tuesdays, they are at 8 a.m. and on Thursdays, they are at 2 p.m. We include links to those in our last minute lowdown e-newsletters. Let's see, and usually when I send out an email reminder prior to the webinars, I will include the link to the Thursday one also, but just so you keep in mind, those links only work once the meeting has actually started. All right, so Penny, do you have any other remarks to add before we start wrapping up and move on to questions?
Well, I do want to share that, guidance changes based on what we learn. So, it's always, as we learn more, we know more, we do better. So, as we learn more about the factors surrounding COVID, that guidance does change. And as I said, we'll always keep working on trying to keep everybody as updated as possible. And just thank you for the opportunity to be here today. And I'm looking forward to seeing if there are any questions.
All right, so if you want to reach out to Penny directly, you can call her at Quality Insights. Her number is 1-800-642-8686, and then you enter the extension 7644. And you can also contact Penny via email at pimes@qualityinsights.org. And lastly, I want to say thank you to everyone who could join us today. And you can check out our other interviews at qualityinsights.org/QIN vlogs and pods. That's VLOGSNPODS. And at this time, if you have any questions, I'd encourage you to enter them into the chat. We're going to start looking at the ones that are already in here. But while we're waiting, I'd like to again remind everyone about next week's topic for our webinar. It's on myths associated with COVID-19 vaccinations. And to remind you again to look out for that e-bulletin, the last minute lowdown. We did see a couple people say that they don't get those emails right now. So If you could let us know in the chat, but also provide your email if you have already messaged us but didn't give us the email address that you'd like to get those newsletters to, add that to the chat too, and we will get you added in. And then once we have your email, we also send you reminders about these webinars and the office hours and things like that. That way, you know when the next one's coming up. All right. So looking at the chat, some of the questions that we have. All right, so one person said, I'm confused as to why people that are up to date do not get tested, up to date on their vaccines don't get tested. Both of the outbreaks we experienced this year were from up to date vaccinated employees who were asymptomatic and tested positive. What is the rationale for not testing up to date employees?
And basically, and this is one of those things that I think over time could change, but with the variant that we had, the Omicron variant, it was one that affected both vaccinated and unvaccinated. You know, originally with the Delta, they felt that having people vaccinated would prevent them from getting any type of COVID, but then here's a new variant. But at this point in time, what CDC and CMS are saying is that even though we did have a variant that affected vaccinated people, they're still sticking with not doing that testing. Whether that could change, it could change based on what happened with this most recent variant. So that's why I say, and this is, we all have to remember, this is something new for everybody, even, you know, the infectious disease experts at CDC, us especially, and I think in nursing homes, it's really a challenge because we've really, it's nursing homes that have really had the burden of everything, you know, with the way it affects our residents because of, you know, the living situation. They're elderly, they have comorbidities. And so, you know, that testing, the reporting, all of that has fallen heavily on nursing homes. And I know it's a lot for everybody, and not having clear guidance all the time, or sometimes guidance that seems a little confusing, is difficult. But I think if we remember that everyone's learning at this point in time, and these are new things that are popping up, and you know, we all just have to kind of watch for the information to change. Sometimes I'm just as confused as you are, but thank you for the question.
And this other one, I don't, this might be more of a comment. Routine testing was to use the levels of transmission that is found on the county data tracker from the CDC website linked in the QSO. The colors on the county maps are not matching what is in the QSO table 2, and they are not stating low, moderate, substantial, and high. I think does that make sense to you? I think I would have to see like a side-by-side comparison.
Yeah, and I understand what the person is asking, and honestly, okay. I don't pretend to be the CDC expert, but I do know, and it is difficult without looking at those maps. And I do have to say that in our last the last minute lowdown, we did include a picture of those maps and where you could find them on the CDC website. And I do know though that they are color coded, and there is, you know, the county tracker, and then the community level, and then the community transmission level. You sort of have to look at both of them. And then there's like a for the colors, and then there's a graph. And I think the color code does actually state whether it's considered a low, a moderate, high. That's my understanding. And I would have to look at that again. And if you have a question regarding that, that is something that we would be more than happy, you know, to look at. And I don't know if Sheila or Patty has an answer to that question at this time.
Someone else commented, they said there is a new link right about the map that they're looking, I might be reading this wrong. There's a new link right about the map that they are looking at that will take them to the correct map right above. Oh, so they meant to say right above the map, there's a link.
Yes. Yes, and thank you. And that is Deb Wright. And I would like to say welcome, Deb. She's a new Quality Insights employee. So we're very happy to have her here. And Deb is right out of working in a nursing home. So she's used to using those maps and the testing and all those things that come along with it. And yeah, she had actually mentioned this to me a day or two ago, that when she was looking at the maps, they're right above that map on the CDC website, there is a new link and it will take you to where you need to go. Thanks, Deb.
Yeah, those maps are funny. Sometimes I have to use Control F sometimes to find the one, because it's like I was looking at it, I saw the map on the page earlier and I can't find it now. I have to use Control F on my computer to find the map, and it's there, but I just keep missing it sometimes.
Yeah, I do see that there's a question. Someone said to share the language related to holding times 2 weeks before you reduce the frequency. So let me see. So no longer have to pick the date's frequency with which we check the community transmission level, but we do still need to wait 2 weeks at the lower level before we can decrease frequency. Does that level change daily or weekly on the CMS COVID data tracker site? If anybody knows, I do not know if the level changes daily or weekly. If anybody has that answer, feel free to type it into chat. If nobody types it in, we can get back to you. If you could provide us with an email, or we can send out answers to questions. Yes, within the CMS memo, I have them pulled up here on my desktop, which I'm going to look at real quick here. It is within the memo. Oh gosh, look at me. I pulled up 39 instead of 38, telling all you to know which one's which. Okay. And that was in the original 38 nursing home memo for testing, and is still in the revised memo. And gosh, I'm trying to find it. So on one of these pages down in for the testing.
And while you're looking it up, we had the links to those memos in last week's last minute lowdown, and I can keep it in this week's last minute lowdown so that people know to look for it. That way, if you are looking for that this Friday, when we email that out, we'll have the links to those memos too.
Yes, and in that memo, it's on page 6, where it does talk about the routine testing table based on the level of community transmission reported in the past week. And then it recommends there about, that's where it has 2 bullet points. And it says if the level of community transmission decreases to a lower level of activity, the facility should continue testing staff at the higher frequency level until the level of community transmission has remained at the lower activity level for at least 2 weeks before reducing testing frequency. So that is actually in, oh yeah, that's in the memo on page 6 of the revised memo, if you want to look that up. And let's see, were there any other questions? Just a comment. It would be nice if CMS shared the same sentiment about the fact that we are all learning together. Nursing homes are blamed and held to a different standard than any other healthcare entity, especially hospitals, and they are punitive. And I understand exactly where you're coming from. And we do share with CMS frequently that what we hear from nursing homes that we have contact with, and the job that you're all doing, and letting everyone that we come in contact to, especially CMS, know that you are doing a great job overall. And I think they know that. It's just that sometimes there's so many expectations that, you don't always hear that. But please know that we at the QIO definitely, we're an advocate for quality improvement first, and quality improvement helps improve quality of care for the residents. So always the residents first, but then nursing homes and their staff, absolutely, we advocate for you also.
Before we wrap up, I think we had one more comment back on the maps again. It says, note the COVID-19 community level and the associated metrics presented above are updated weekly on Thursday and may differ from the values for the same metrics presented below, which are updated daily.
Thank you so much, Kelly. I appreciate that. You
Yeah.
know, that's the other thing. We give these presentations, but we want you all to be part of it because we learn as much from you. And then that helps us all do better. So I appreciate that.
All right, so this has been great. Do you have anything else to add, Penny?
I don't think so. I'd just like to thank everybody for attending today.
Yeah.
Really look forward to working with all of you on an ongoing basis.
Just saw another person mention that they wanted to be added to the mailing list. So if you could, if you haven't already, please drop in your email again if you didn't add your email that you would like to receive them to. And for those of you who did get to this webinar via an email reminder that we sent out, you're probably already on the list. And so you should make sure that maybe the e-bulletin's not going to your junk folder, because we use the same email list that we sent that out with to the people, for the people that we did with the email reminder. It's the same list. So it's called the Last Minute Lowdown, goes out Fridays, usually toward the end of the workday. All right, so I'm going to wrap up. Oh, and I also wanted to say, if you liked this webinar, we upload our webinars to YouTube, and we also upload them to a podcast format if you're like me and you like to just like listen while you're out walking or brushing your teeth. And we include those in the Last Minute Lowdown too. All right, so to wrap up, again, I just want to thank everyone for your participation. We hope to see you next week, and we hope that you all have a great afternoon. Thank you so much for coming, and we'll get all these emails that you have been dropping in. We'll get you added to the list. Thank you so much.
Thank you.